Hi everyone, my name is Emiliano Aguilera of second semester of medicine of the Universidad Autónoma de Durango campus Zacatecas. And today I will talk about the Patau syndrome, known as trisomy 13, that this is a rare but very serious genetic condition that it's happened when a baby born with an extra chromosome 13 that cause multiple organs and developmental problems. Ah, uh, this This syndrome was discovered in 1960 by this man, Dr. Klaus Patau, using a technique called karyotyping that is one of the three main trisomies along with Down and Edwards syndrome. In a normal cell, we have two copies of each chromosome, but in this case, there are three copies of the chromosome 13. That's what causes the syndrome, and it can affect all the cells in the body or just some, depending of the type. Oh, well, the main cause is an error during the cell division and something called the non-disjunction. And before I mentioned the types of this cell division, and these are the three types called the full, the mosaic, and the partial. Both may can be a rare division called the duplicated. Um, One of the most important risk factor is the advanced maternal age. That the older the mother, the higher the risk. Sadly, there is no cure for this condition, but there are treatments to manage the symptoms like doing the doctor's surgery for the heart defects, the feeding, help with the feeding, or can offer a palliative care to keep the baby comfortable. Some of the most visible symptoms are the cleft lip, extra fingers or toes, and a small head, and internally the babies often have a heart and a brain problems and a very delayed development. This syndrome is a very rare condition that it's seen about in one of every 10,000 to 16,000 births. Then it's more common in girls, and sadly, most of the babies don't survive their first year. The prognosis is very poor because most of the babies live only a few days, usually less than 10, and only about 5 to 10% survive beyond the first year. And in some mosaic cases, the kids can live longer because, like we talked about before, there are treatments that can improve their quality of life, but there is a very low percent. The Patau syndrome affects many systems: the brain, the heart, the face, the limbs, and even organs like the kidneys. That's why it's so severe. It impacts almost the whole body. For the conclusion, the Patau syndrome is one of the most serious genetic disorders because there is no cure. With a early diagnosis, we can give to the babies a more comfortable life, even if it's short. Uh, this is, these are the references to make this exposition, and thank you to see the video, and goodbye.